Hello, I'm Alex Metricardi, Chief Marketing and Public Relations Officer for Living Branches, and today is Wednesday, December 23rd. I'm here again with Ed Brubaker, Living Branches President and CEO. Nice to see you again.
Good to see you, Alex. And we're doing this a little early this week since Friday is Christmas.
I see you have your official Christmas tie. I have my Christmas earrings. We're all set.
We are all set. Well, at least for what we're wearing. I don't know if we're all set for Christmas, but what is Christmas anyway? We say, are you ready for Christmas? And it's like, we've interpreted Christmas to be ready with our packages, and
yes,
that's maybe not the true meaning of Christmas.
I think I would agree with that, especially this year. Well, let's start with a summary of where we are with COVID on our campuses. And we will start at the Willows and say there's no COVID on our campuses right now at the Willows. We have one staff person who had tested positive, I think probably 13 days ago now. So I believe they just did their last round of testing for that yesterday, and we are waiting with fingers crossed to see our results from that. At Souderton right now, we continue to have two persons in residential living, although one is just coming off the end of their quarantine. So really it's, I think, one person who has symptoms. We have now 5 persons in personal care who have tested positive for COVID. And in healthcare, we have 13 persons. And staff, we have 6 persons at Souderton who are testing positive right now. At Dock Woods, that number is 3 in residential living, 8 in healthcare, and 6 staff persons. So still spreading, certainly not as rapidly as we saw in the spring. But this is really the first time that we've had actual spread in personal care at Souderton. And so that's something new that we're dealing with right now.
Yeah, that's right. And the challenge, too, of personal care, I was talking with Monique late last night about it. And the challenge is cohorting and trying to control the spread. And we had talked about opening up the COVID unit, but personal care residents are not used to living in congregate spaces. Not that healthcare is either, maybe 2 persons in a room. But yeah, that was the challenge. And so I know we're coming up with some different approaches, but that's the challenge, to try to contain the spread.
Yeah. And of course, we're testing residents, we're testing staff, no meals in the dining room, no activities, things like that, to really try to keep residents in their rooms as much as possible, so that we can hopefully minimize that spread. But they've got at least 14 days of testing ahead of them, at least once a week, to try to get our hands around that.
Yeah. And if you think about it too, even within our facilities, though, we're still, it would seem to be lower than the spread in the wider population. And so you have to keep that in mind as well. I mean, it is, I would say, out of control right now across the U.S., and particularly in places like California and otherwise. And so, frankly, while it's unfortunate, it's not a surprise that it's making its way back into retirement communities and nursing homes.
Yeah, I think the positivity rate this week in Montgomery County is still above 11%, and Bucks County is significantly higher than that. So it is not surprising to see that. I guess the other big news that we've spent most of this week working on is vaccine information. So by the time our viewers are watching this, they will have already received information about vaccines. One of the updates that we should make over what we shared last week is that I believe just today, Jen Durstein at the Willows of Living Branches received the first email from CVS about a vaccine clinic there. So when we spoke last week, we were uncertain if we were going to be able to vaccinate Willows residents, but it looks like we will now, although we don't know when.
Yeah, that's true. And the other thing to keep in mind is, and I've said, until CVS shows up on the day they're scheduled with the vials that we can actually count and say, how many do you have? I mean, the reality is this is such a logistical challenge. Until they actually show up with their vials and we know how many vaccines can be given on that day, that's when I'll really have confidence to say we have X number. Or like in the case of Grandview Hospital, I know they've gotten and they actually received their doses for their staff. Yes. And that's how they're doing it, I guess, within the hospital system. So until it's here, we won't know, because it's really a logistical challenge to pull all this together, and so we need to understand that and give them a break too to be working through it. But we're at least excited that there is good possibilities because we really do feel that this gives some good hope to keep moving to the other side of this.
I had and maybe I will just say as a reminder for residents and for staff and for family members, for persons being vaccinated, we need a signed consent form. Now, for residents whose POAs are not on campus, obviously, that can be done verbally or electronically. But we need a consent form, and we also need copies of insurance cards front and back. So everyone has a little bit of work to do with this. And then, yes, the logistics of getting all that together is quite interesting. As a reminder, I had a difficult conversation last night actually with a daughter of a resident in residential living who was calling me to understand when her father would be able to get his vaccine. We did talk about this last week, but we still have, in fact, I was on a webinar yesterday with CVS, and they were confirming residential living residents, independent living residents are not being vaccinated in this go-round.
That's right. Yeah, and I think that's the reality, and there's going to be a process to go through it, and so we'll work through that. But I am heartened and encouraged that she's saying, when can I want my father to get it? And so that's certainly part of what we're continuing to work at. Look at our website. There's going to be more information coming to that. Get educated, get comfortable, because I want everyone. I recognize that's not probably going to happen, but I would love everyone to get it. But if we can't get everyone, at least 70 to 80%. And I'm planning to get it. I know some politicians are catching grief because they're lining up and people are saying, you haven't done anything for the last 8 months. I literally heard, was that New Hampshire governor saying they haven't done anything in Washington? Why are they, prioritizing themselves? I don't know that I would completely agree with that, but I understand the perspective. Having said that, there is also the perspective that's being stated. We want people to be comfortable, and leaders are persons that people look to get them comfortable with doing it. And so I am 100% behind the vaccine. I want to get it myself. The question will be, how many doses do we have, and is it appropriate to get it? But the reason I would get it, and the reason I will likely get it, is so that we can show people, on video or otherwise, me getting it, just to really provide encouragement to people to get it. If it's good enough for me, it's good enough for everyone else, or vice versa. And so we really want to encourage people to get that vaccine. It is not going to make life go back to normal right away, and we can talk about that a bit if you'd like, about the process. It's going to still take time, but it's a absolutely important step.
I saw something in the news this week about, I think, a hospital system in California where it looked like the line workers were revolting because the administrators and persons who weren't even on campuses had been vaccinated first. And so maybe just to clarify that I do believe it's very important for you to get the vaccine in order to share that message. But our priority is getting our workers in healthcare, personal care, dining, environmental services, the people who are there on the ground.
Yeah, absolutely. Yeah. I mean, they are the people that are dealing with this day in, day out. I'm not on the campuses as much as I used to be. I do get there periodically, but nothing to the level of a direct care staff worker, et cetera. And it's just really important for them and for our residents to get this vaccine, just very, very important.
And so we are hoping that we will be able to vaccinate all of our staff persons, but like the marketing team, I think will be at the end of the line instead of the front of the line, which is totally appropriate.
Yeah, and we're hoping that we get enough that we won't have to decide that.
Yeah.
But again, time will tell.
Who knows? So part of the logistics with this are just the logistics of how are we going to do it, but the other part is education. And so we are building the website probably as we speak right now, putting up video information, frequently asked questions, links to CDC and other resources. So if people have questions and want to get answers, please go to livingbranches.org/coronavirus, and then there's links all down the left hand. There's a vaccine resource page on the left nav bar that they can go to, and there's a whole bunch of information there.
Yeah, and I would just encourage people to look at our website, but to go on CDC and other reputable websites to educate yourself, get comfortable, and get comfortable quickly.
Well, because as you said, this is the first step to get back to normal, and we got to take it.
Yeah, that's exactly right. That's
Because
exactly right.
I can't do 2020 again next year.
Yeah, no, I can't either. And I would say that'd be true for probably all of our staff and all of our residents. And so this is not this magic thing that's going to transform as of the next day after the vaccine. Because as I said before, I'll say it again, you take it, 21 days later, you get the next dose, and about 2 weeks later, you might have good immunity. So it's a period of time. Now, who knows what your immunity might be during that time, but it certainly isn't maximized until that period of time. So if you extrapolate that out and kind of layer that over these next months, it will take time. And so when people say, do I need to wear a mask? Can I travel right away? Well, the answer to those things is yes, you need to wear a mask, and no, you can't travel right away. These are things that will layer off in the future. Yeah. But what we don't know is if you can transmit the disease, certainly not from the vaccine, because there's no live virus, but if you would actually have a touch of the disease, could you be an asymptomatic spreader until you're immune? We don't know that, and so the best plan is to wear a mask. And honestly, I got to tell you, it's not that hard. For me, the hardest thing is sometimes I walk out of my office and say, oh, I don't have my mask on.
Yeah.
To remember it, or you're walking into a store and all of a sudden you're seeing all these people with masks on and you're like, oh, mine's in my car still. But honestly, folks, it's not that hard to do. So let's keep doing it. Let's be disciplined. Let's keep doing it. We can't travel right away, but let's get this done so we can eventually get there. Yeah. If we just slough off the vaccine, we're going to be a hard time and a long time coming to get through this. So let's do it a step at a time, and it'll happen.
And remembering to wear the mask, making sure you have it in your car to go to the grocery store. Those are not difficult things. Mm-hmm. For our staff members who are in active COVID outbreak, those masks are a totally different story.
Yeah.
And again, we want to be to the place where we're not doing this anymore.
That's exactly right. And I would invite any John Q. public who is anti-mask or frustrated with mask wearing when we're talking surgical masks, let me bring you into our facility. Let me put you in a gown. Let me put you in gloves. Let me put you in an N95 and a surgical mask over that. Let me put you in a face shield, and then let you care for residents for 8 hours a day. And, we've got to start having empathy for each other and what we're going through and work together to get to the other side of this. Very strongly believe in that, but it's very hopeful that the vaccine will start to get us in that direction.
And I'm not trying to wax philosophical here, but there is something appropriate about rolling out a vaccine that is bringing us hope at Christmas.
Absolutely.
Like, it just makes sense.
Absolutely. And that's maybe what we can end with today, because, again, the core of this is just to give a small update and remind people to check our website, to get educated. Things are coming out. That's how you'll learn about it within Living Branches, and we want to keep you informed. But absolutely, there's hope for the future. And it's interesting, I was thinking the last few days, a lot of times you'll say, are you ready for Christmas? We kind of joked about this earlier, or are you in the holiday spirit? And it's interesting when you think about it, okay? In the Christian tradition, obviously, that's where Christmas comes from. And the early Christmas was not about Christmas carols and sitting around going to, having Christmas music playing on B101 or going to holiday parties or going to King of Prussia Mall. Okay, that was not the original Christmas spirit, folks. And so, frankly, us staying at home, maybe as more like the original Christmas in the stable by themselves, scared and lonely, not even being able to get a room at the inn, doing things that were not comfortable to them. We're in this, we might as well create the analogy and make the comparison and say, maybe, just maybe, we can experience a little bit more of the original Christmas this year and recognize the sacrifices that were being made then, the reality of being in a stable, not in an inn, when we complain about not being able to do the things we normally do. So maybe the Christmas spirit we experience this year will be a bit closer to that original Christmas those many years ago that provided hope for the world, frankly. And just as now today, we're experiencing hope with the vaccine and the treatment processes that are available, that we can be hopeful that 2021 will be a better year than 2020. And I'm really hopeful for that, but it will take some time and it will take continued discipline. But I really do hope that people have a wonderful Christmas, a Merry Christmas, a happy Christmas, a joyful Christmas, a meaningful Christmas, even though it's going to be very different this year for most of us than many others in the past. But maybe, just maybe, we can reflect and take us closer to the original Christmas back those 2,000 years ago.
And if you strip it all away, the original message of and meaning of Christmas is there is a God that loves you. And I think that is so appropriate now, because I think that's what's gotten a lot of us through this year, is just remembering that fact.
That's right. That's right. And really the idea of Christmas is, as you say, is love from God, but also love that humans can have for each other. And I would just reflect, I would hope that in 2021 we can work at that, I would say better than we have been for these past years, that we can truly find ways that Republicans can respect and love Democrats, and vice versa, Democrats respect and love Republicans, that we can join together with people who are different from us, that the black and brown communities can feel more and become more a part of our society, that for many years it has not been that place for them. And so I really do hope that we can, through these processes, really do some soul searching too, as individuals and as a nation, to say, let's do better. Let's use this difficult time as a way to become better people, better individuals, but a better society, a more loving, a more kind society. I saw a sign the other day in somebody's yard. It said, let's make America kind again. And honestly, that would be my hope. Let's be kind to each other, and let's work together for a better tomorrow.
Yep. Well, Merry Christmas.
Thank you. Merry Christmas to you as well.
Thank you. Merry Christmas to our viewers. Again, please visit our website, livingbranches.org/coronavirus, for all sorts of updates and information, and have a wonderful holiday.